I actually was always interested in science. So I would say my parents and my grandparents were responsible for that. So my parents let me play outside a lot, and I was like always running experiments as a kid in the backyard. And then my grandmother was the first person to give me like a kid's computer, and that was dangerous for me because I was constantly reading the little slides that it had. And then my dad's dad actually is the one who got me interested in biomedical research. He had been in a Nazi concentration camp and had experiments performed on him. And so as a child, I always wanted to understand like why that had happened and what role could I play I loved science. So I was like, how could I make it better for people? My current dissertation project focuses at the intersection of remote monitoring and real-world evidence collection. And then my disease focus is in cerebrovascular disease, broadly speaking. So it's very exploratory. And what we've been working on is using a smartphone app that records different GPS and accelerometer data as you go about your daily living, and then also can collect behavioral data through surveys and other types of interview collected information, and try to correlate that to see what changes might be occurring before like severe cerebrovascular disease diagnoses. And so we're hoping that by using this type of a pilot study, we'll be able to look at time points where we might be able to best monitor these patients and see when to bring them in and when to start looking at alternative therapeutic or non-pharmacological interventions that might improve their long-term prognoses. We all have tons of apps on our phone, right? And we all have different tools on our computer, but figuring out, okay, like in a healthcare setting, is it better to engage this person outside of a clinical environment? Do they get more of a cost benefit analysis from that visit? Or should we just be bringing these patients in person because something else is going to get missed or lost along the way? Is there data from outside the clinical environment that can augment those in-person visits? You know, are these types of emerging technologies in healthcare, are they replacements for already for the standard of care already existing, or are they supplemental? We don't know the value of a lot of these digital technologies. It's one of the biggest questions on Capitol Hill and in any like HHS and state government, state agency. Well, which patients are best fit to use these? Which would clinically benefit the most? What populations? And then what technology should we be using? Should we even be trying these telehealth visits? Should we only be using different, like monitoring tools that might just automatically collect different sensor data? Those questions haven't been answered, and you'll always get those questions if you're in a health policy setting. And actually the answer is difficult. It's like, well, we need more data and we need more high quality data to try to find those insights and then target solutions. I found that a lot of patients who might be from more underserved communities, they are oftentimes not represented in digital health studies. So you'll get like a giant database, and these exist really around the world, where primarily the data available is from white patients. And you oftentimes will see organizations maybe try to scale that type of an approach to their population that might be, say in the United States, might be Hispanic primarily, or African American, or even Native American populations. And the programs are not able to scale as easily at these, like sometimes in federally qualified health centers, just because there are other issues that patients might be facing in their personal life, like on different reservations. If patients go home to a Native American reservation and it might be a location where there isn't electricity access, well, providing these digital tools isn't going to help that patient. So it's interesting to start seeing like where are ways we can address improving equitable access in digital health.